Okay.
Okay, so good evening to all the participants over here. First thing, I want to let you know that where did I met Dr. Shoaib Sabir sir. So when I was learning PHATAK repertory with many virtual gurus, then I came across to a video on YouTube, which was of Dr. Sabir sir, and I think he had put more than around 3 videos on YouTube about PHATAK repertory. So I have gone through all those videos, and literally I can say I have become fan of him from that day. Then it has been a long. I think I have commented below his video also when I have seen. I think recently I have again seen those videos 2 or 3 months back again. So that created interest in me to have contact number of sir. Then somehow I can got the contact number, requested sir to come on our platform to talk about PHATAK repertory. Because the way he teaches, I like that way. That was the what we can say, that lecture is was in Hindi and English, but that Hindi was in Pakistani plus Punjabi accent. So I will request everyone that to have your attention whenever sir is talking. Sir has done his BHMS and he's practicing at 4 places in Pakistan. First is Gojra, then Lahore, then Rawalpindi, and also he has done his BHMS. Then he is Master of Philosophy. Then he has done MS in Public Nutrition, and he is also pursuing his PhD in Pakistan. So I will request all that please have your attention, and we welcome Dr. Shoaib Sabir sir, that he had agreed to give his valuable time and come on this platform. So it's over to you, sir. I will make you pass so that you can share your PPT.
First of all, I would like to pay thanks to Dr. Pradeep Bagal. Sir, thank you for this opportunity, and many more participants all over India and Pakistan, Dr. Abu Bakar, Dr. Akbar, and many more Indian participants, Rashi Agarwal, Dr. Sunita, Dr. Poonam. I pay personally many thanks to attending this session. Sir, how I can upload my screen?
Your host, sir, you can share now. Yes, your screen is visible now.
My screen is visible.
Yes, sir. Dr. Shoaib Sabir, PhD, Eastern Medicine. That the first slide we can see.
Is it okay?
Yes, sir. Fine.
Yes,
Should we First of all, I would like to again thanks to all of you for being here with us. And again, I am thankful to Dr. Pradeep Bagal. Today, my topic is practical journey through PHATAK repertory. In this presentation, I will share my understanding toward PHATAK repertory, how I can get benefit from the PHATAK repertory, and what is the tips and tricks I will share. In this presentation, this is the layout. Firstly, I have some clarifications about repertory and about PHATAK repertory. Then we will study what is the base of homeopathy, what is the base of repertory, what is the base of PHATAK repertory. Then the structure, indications, and content indications of PHATAK repertory. After that, we have some practical work. There are some clarifications. Firstly, repertory is not the only way to success. There are many more approaches. There are Prefel-Vajaker approach. There are polarity analysis. There are sensation method. There are a number of methods. Even there are, if we will see the repertory, there are many more repertories. Kent repertory, Boger-Boenninghausen repertory. Repertory is only one of them, one way of them to success in homeopathy. Some may say repertory is a calculator. Yes, you may say it's calculator, but you have to identify what is the exact numerics, adding and subtraction as well. Repertory is just a tool. Repertory is just a tool. If a patient, if you want to visualize the sky, it's just a telescope. You have to identify what you are looking for. You are looking for stars and moon, whatever you want. You have to identify. First of all, you have in your mind what is your location, what do you want to find. It's a sportive, and it's just a tool. If some people may say repertory is the number of rubrics we will add in the analytic box, जिस तरह हम मैकेनिकल रेपर्टराइजेशन कहते हैं. पेशेंट में से आई हैव हेडेक, हमने एक रूब्रिक ऐड कर लिया हेडेक, उसने दूसरा रूब्रिक बताया एंजाइटी ऐड कर दिया. तो if we pursue that kind of cases, we will definitely fail 100%. Might be some patient have lucky hit, otherwise we will fail. The second most important thing is base of homeopathy. Base of homeopathy depends upon individualization. Individualization, the word individuality comes from when we have a case. Hahnemann says in aphorism 83, individualizing examination of a case of a disease for which I shall only give in this place general direction of which the practitioner will bear in mind. This is the most important thing, only what is applicable for each individual. The individualizations come from the Hahnemann aphorism, and then Hahnemann pay some more attention, demands of the physician nothing but freedom from prejudice and sound senses. Hahnemann ने ये कहा कि patient को individualize करें. We have to focus on individual response of the patient, but the second important thing Hahnemann says, demand of the physician nothing but freedom from prejudice. That's mean freedom from prejudice mean you have to see the patient as it is. If a patient comes to your clinic and he's sweating on forehead, we will say it's calcaria. We will fail that. Hahnemann limit that kind of things. Firstly, we have to see the base of homeopathy is individualization. Hahnemann, next, what we have to see in a case, we have to see more striking, singular, uncommon, and peculiar signs and symptoms of a case. This is the short introduction of homeopathy.
So slide change नहीं हो रहा है, तो this is general discussions, no?
Okay.
We can see only first slide. Okay. Now okay.
सर स्लाइड शो कर दीजिए तो स्क्रीन पे फुल विजिबल होगा.
अब स्लाइड शो हो रहा है?
Sir, we have gone to the slide number 13 directly. तो आपको पहले जाके स्लाइड शो करना है या तो मूव करना पड़ेगा?
No. Just continue from here.
So it's on 13, slide number 13. This is
sir is talking about
that is
13
why.
only. Yes. Sir, please continue from 13 onwards. You are talking about this aphorism 153.
Yes, 13. Aphorism 1, we have to focus, if we want to individualize of a patient, we have to focus on what is more striking, singular, uncommon, and peculiar sign and symptom. What is the strange, rare, peculiar sign and symptoms of a case? We will see in the what is repertory. Sir, the bill, if I have to explain the repertory in simple words, repertory is the full of individual responses. What Hahnemann says, the individual responses is important. Repertory is the index of individual responses, individual reactions of certain conditions or of certain types of disorders. Repertory is only helps to find the PQRS symptoms. Repertory is a tool. Repertory helps in finding PQRS symptoms, peculiar, rare, and strange symptoms. Sir PHATAK explained that the repertorization doesn't mean mechanical repertorization. फाटक सर की मुझे ये बात मुझे बहुत अहम लगती है कि उन्होंने कहा रिपेट्राइजेशन डजंट मीन द मैकेनिकल रिपेट्राइजेशन। जो हम गलती करते हैं अमूमी तौर पे कि नंबर ऑफ पेशेंट कम टू सी एस, पेशेंट ने कहा मुझे हेडेक है, हमने कहा हेडेक वाली सिम्टम ले ली, स्टमक ले ली, उसने कहा बैक है वो ले ली, लंबर है वो ले ली, जितनी सिम्टम्स थी उनको लिस्ट कर लिया। तो सबसे पहले सर फाटक ने ये बात कही है कि रिपेट्राइजेशन मीन doesn't mean mechanical repatriation. The totality of symptoms does not mean numerical totality. When we have to repatriate the case, there is no need to the number of you have number of rubrics add 1, 2, 3, 4, 5. Only we have 6, we have 7. They say, Sir Phatak said, what qualitative totality? What does mean qualitative totality? One peculiar concomitant,
Sir,
one peculiar
we
concomitant
cannot see the
are
next. Okay, okay. Now we.
okay.
Now visible.
Sir, is it okay? One peculiar
Yes, sir. Okay now.
concomitant or an unusual condition may the totality of the case. If if a patient if we have only one symptom which is denoting to the patient specifically, it may be one concomitant, one unusual condition may determine the totality of the case. PHATAK repertory, base of PHATAK repertory is based on bogus synoptic key, and the more important thing is idea of generalization. Construction of PHATAK repertory की construction अगर देखें तो ये है alphabetical. Alphabetical mean A for abdomen, B for bladder, C for constipation, M for motion aggravation malnutrition, P for pressure, U for ureter. I think sir इसकी understanding तो है ना सबको?
यस सर, ऑलरेडी इंट्रोडक्शन पार्ट सर
Yes,
ने
sir,
लिया
है।
है पहले 3 चैप्टर।
Okay. The second construction of repertory, the second part is Boger's Phatak repertory based on Boger's synoptic key. Boger's synoptic key, generally if you read Boger's synoptic key, you will see any remedy have the uh, three things. First, sphere of action. Second, pathology. If
Sir, slide
arsenicum
change कर next. हाँ, right. Alphabetical तक आ गए. Okay. Yes, sir, right.
अगर बोगर साइनोप्टिक की बात करते हैं तो स्फीयर ऑफ एक्शन एक तो बहुत इंपॉर्टेंट चीज है उसमें। जब हम कोई फॉर एग्जांपल वी आर सीइंग आर्सेनिकम इन बोगर साइनोप्टिक की, वी विल सी फर्स्ट few lines the sphere of action arsenicum in mucous membrane, the sphere of action is arsenicum on mucous membrane, circulation whatever thing. The second important thing is कि पैथोलॉजी क्या प्रोड्यूस करती है, थर्ड ये सिम्टोमोलॉजी क्या प्रोड्यूस करती है. टुडे वी हैव टू कंसर्न इज द ग्रैंड जनरलाइजेशन based on generalization. Grand generalization. Generalization means generalize the local symptom. इसका मतलब ये है true for
Sir,
the
slide change.
part is true for the patient.
Done.
पाठक रेपर्टरी बेस करती है जनरलाइजेशन पे. दिस इज द मोस्ट इम्पोर्टेंट थिंग इन दिस प्रेजेंटेशन. अगर हमें ये समझ आ गया ग्रैंड जनरलाइजेशन क्या है तो हमें फाटक रेपर्टरी समझ आ जाएगी. ग्रैंड जनरलाइजेशन का मतलब है जनरलाइज द लोकल सिम्टम. ट्रू फॉर द पार्ट इज ट्रू फॉर द पर्सन. This is a picture in which there is one drop of the ocean. One drop of the ocean has the same characters, same which the whole ocean has. There are some examples of grand generalization. If a patient has headache after ailments of cold drinks, if a patient has stomach
Sir, slide change,
after
please.
cold drinks, if a just a minute. सर ऐसे ठीक है?
सर स्टमक एक दिख रहा है अभी।
सर अभी मैं थोड़ा रुक के ग्रैंड जनरलाइजेशन को थोड़ा मजीद एक्सप्लेन
यस सर
करता हूँ।
कर
इसका
लीजिए
मतलब
सर
है
कर
ट्रू
लीजिए
फॉर
कोई
द पार्ट
प्रॉब्लम
इज ट्रू,
नहीं। यस सर यस सर।
फॉर द पार्ट इज ट्रू फॉर द पेशेंट। इसका ये मतलब है अगर एक पेशेंट है, उसके सर को मसला है, एक पार्ट को है ना, या एक आंख में दर्द है और आंख में पेन इन लेफ्ट आई एंड मेलुएशन बाय प्रेशर, एक पार्ट में प्रॉब्लम है और मेलुएशन बाय दबाने से सुकून मिलता है। अब इसी जगह पार्ट को चेंज करके हम ये कर लेते हैं कि गले में दर्द है और पेशेंट कहता है कि मैं ऐसे थोड़ा होल्ड करूं, दबाऊं तो सुकून मिलता है। अब ये भी एक पार्ट है, ये भी एक पार्ट है। अब जो बड़ी रेपर्टरीज में हम क्या करते हैं, बड़ी रेपर्टरीज में हम जाएंगे, पूरा एक चैप्टर लेंगे, थ्रॉट लेंगे, उसके आगे जाएंगे पेन लेंगे, स्पेसिफिक एरिया लेंगे, लोकेशन आइडेंटिफाई करेंगे, उसके बाद में वो मोडेलिटी लेंगे। इसमें क्या करेंगे कि लोकल एक पार्ट लिया, उसकी जो सेंसेशन है हमने ये समझा कि ये पूरे 1 यूनिट पूरी बॉडी की सेम सेंसेशन है। हमने एक रूब्रिक लिया, मैं आगे इसको एक्सप्लेन करता हूँ कैसे। सर ये स्लाइड चेंज हो रहा है, हेडेक वाला आया?
सर नहीं आया।
नो सर।
अब आया, अभी चेंज हुआ।
सर हुआ है।
यस
Just a minute, I have to... सर अभी स्लाइड चेंज हो रहा है, देखिएगा, स्टमक एक आया।
आया है आया है।
ओके, here is a part, we have, here is a part is head aggravation from cold aggravation. The second example is stomach aches aggravation from cold drinks, toothache aggravation from cold drinks, pharyngitis or laryngitis maybe aggravation from cold drinks, cough from cold drinks. We have only one rubric for all of them, कोल्ड एग्रावेशन, जनरली फूड आगे गए, कोल्ड में एग्रावेशन एक रूब्रिक काफी है। अब वो कोल्ड एग्रावेशन को हमने जनरलाइज उस मोडेलिटी को, अब वो कोल्ड भी हो सकता है, वहां पे ओवर ईटिंग हो सकता है, वहां पे वार्मथ एग्रावेशन हो सकता है, वहां पे एग्रावेशन मेलुरेशन हो सकता है, वट एवर एनी मोडेलिटी इन दिस एरिया, प्रेशर एग्रावेशन मेलुरेशन हो सकता है, किसी भी बॉडी पे होगा तो हम जनरलाइज करेंगे। हम इसको नेक्स्ट वी हैव टू अंडरस्टैंड विद एग्जांपल्स। देयर आर सम मोर एग्जांपल्स of generalization. For example, a patient has sciatica and pressure amelioration. If the patient has stomach aches, pressure amelioration, we will take only one rubric, pressure amelioration. Headache amelioration by DHARM, your stomach. This is the some examples of generalization. We may generalize the modalities. We may generalize the sensations. For example, we may generalize the modalities, cold aggravation evaluation. If a patient has any ailments from cold, we may take cold aggravation or evaluation, warmth aggravation evaluation, pressure, bathing, motion aggravation evaluation. Yeah, there are some examples. Another examples of generalization is sensation. We may, if a patient has the burning sensation in throat, burning sensation in stomach, burning sensation in anus, we may take one rubric. We may generalize the sensation burning as we have to generalize. The second important, as I said, we may generalize the sensation as cramps. We may generalize, we may pulsation. A patient has pulsation headache, pulsation in stomach, pulsation in any part of the body. We may generalize the symptom. Generalize. There are some more examples of generalization. We may generalize the specific locations. For example, ureters. When we have to generalize the ureters, the sphere of action of remedies, जिन remedies का sphere of action ureter पे है वो pop up करेंगी. Fallopian tubes, we may generalize them. We may have to see Which remedies have the action of gallbladder? Which remedies have action on duodenum? Some patient may say duodenal ulcer, duodenum, whatever. Wisdom tooth को generalize भी कर सकते हैं. No, there are. हम अगले topic में जा रहे हैं कि when to use PHATAK repertory. These are the when indications of PHATAK repertory. The main idea of PHATAK repertory is generalize the local symptom. It's especially useful in ये हम वहां पे यूज करेंगे when there is characteristic symptoms are not available. If the characteristic symptoms are available, we have to jump in the bigger repertory. For example, a patient may say, I have a headache and extend its extension to the right eye and then close. It's a specific symptoms of some remedies. It's a characteristic symptom. If we have specific characteristic symptom, we will not, PHATAK repertory will not help. Second, if the modalities is well marked, use PHATAK repertory. If there are some few only less symptoms, few symptoms are present, we may PHATAK repertory. We may use PHATAK repertory. There are some contraindication of PHATAK repertory. If the characteristic symptoms are present, we will not use PHATAK repertory. If the mental symptoms are most prominent, the fears of the patient, the dreams of the patient is more prominent, we will not use the PHATAK repertory. If the mental picture is clear, we will not use PHATAK repertory, we will use bigger repertories. If there are some case examples. I had a case of nasal polyps. A patient, 34 years male patient, present nose obstruction. Patient has congestion and stopped cryza, and patient present with acute sinusitis. On examination, there was a nasal polyp. Nasal polyp was on right side only. Patient have very peculiar symptom, obstruction of the nose. मैं जिस side पे लेटूं वो side बंद हो जाता है nose की. If I lie on right side nasal nose will be obstruct. If I lie on left side side will be obstruction. Sir, what should we do if any participants will give their opinion?
Those who want can unmute their self and talk.
Sir, we had a patient. I want anybody can help. What should we do? Patient has nasal obstruction. Nasal obstruction works on side lane on. जिस साइड पे लेटेगा पेशेंट उस साइड वाला nasal obstruction nose obstruct करेगा. And if a patient lie on left side nasal opening will be obstruction will shift on left side.
There is a
Sir,
rubric of
obstructed
obstructed.
lying aggravation.
Okay, good idea. Yes.
Nose polyp.
Nose polyp, good. Good suggestions. अच्छा
And painful side, yeah, affected part on lying.
Yes. Wonderful. मैं डॉक्टर साहब का नाम नहीं जानता लेकिन इन्होंने बहुत अच्छा एक्सप्लेन किया है.
So Dr. Vipin Kushwaha.
डॉक्टर विपिन, वंडरफुल यार, आपने बहुत अच्छा एक्सप्लेन किया. द मोस्ट इंपॉर्टेंट थिंग इन दिस केस इज द ऑब्स्ट्रक्शन व्हेन पार्ट लेन ऑन. जिस साइड पे पेशेंट लेटेगा हम अब बड़ी रेपर्टरीज में हम क्या कर सकते हैं कि हम नेजल ऑब्स्ट्रक्शन, फिर जाएंगे लाइंग, फिर जाएंगे साइड राइट लेफ्ट. हम यहाँ पे क्या कर सकते हैं, हमने जिस साइड पे लेन ऑन को जनरलाइज कर सकते हैं. आर यू सीइंग माय
Yes.
analysis? Is it okay?
अब मेरे में भी कैपेसिटी नहीं, अब तेरे को झेलने की भी।
एनालिसिस नजर आ रहा है?
मैं तो नहीं पढ़ाऊंगी अब। यस सर, दिख रहा है।
Yes, sir.
Yes, sir.
First of all, I what should I do in this case is nose obstruction. I generalize the nose obstruction, generalize the coryza suppressed. Patient may ask the nasal congestion. Third, generalize the direction of symptoms, side lane on. Just side by patient लेटेगा. This is the third rubric, is the main rubric of the case. Fourth rubric is polyps. Fifth rubric I take nasal polyp only on right side. Teucrium to clear case within 2 weeks. I had within the 2 weeks the polyps reduced.
यार उठ जा, मेरे को पता है तू थक गया, पर तू उठ के उठ अपना काम खत्म कर और सो जा।
मैडम अनम्यूट म्यूट कर लीजिए प्लीज अपने आप को। सर आप कर दीजिए नहीं तो।
मैंने कर दी. Teucrium 30 was prescribed on the basis of, according to when I see the patients, I have to focus on which basis I have to prescribe the medicine. There is the second case. This is also very interesting case of it's a 40-year-old male. Pain was back pain around scapula. Patient says pain in my scapula. और उनका the most important triggering factor was जब ठंडे पानी से हाथ धोते थे, हैंड वॉशिंग फ्रॉम कोल्ड वाटर पेन ट्रिगर्स करता था. तो I asked him, is there any position, any postural चीज when the symptoms reduced? उन्होंने कहा कि if I support back in the seat, मेरी सारी symptoms खत्म हो जाती, पेन रिड्यूस हो जाता है. PHATAK repertory हम कहाँ यूज कर सकते थे? when there is less symptom, when there is no characteristic symptoms. In this case, anybody can give their opinion. What should I do in these types of cases when there is very less symptoms, there is no pathological understandings in this case?
Leaning against support ameliorate.
Yes.
And the
Wonderful.
cold water, there is one more rubric in cold, putting hands in cold. I think a
Yes.
single part of has hands in cold water or head feet that aggravates.
Yes. डॉक्टर प्रदीप सर नेक्स्ट सेशन मैडम का रखें, डॉक्टर अपार ना का रखें. सर ने बहुत अच्छा एक्सप्लेन किया. आई हैव ओनली 2 rubrics. The cold single part of as hand in cold water, head feet aggravation. The second important thing, the rubric is leaning. Patient was leaning against the sport amelioration. CPA was prescribed, single dose 200 prescribed. Patient say I have better almost 70%. After that, I have 10-15 days. I prescribed only 1 single dose. Patient was completely, the symptom was gone. Learning was
इसमें
generalized.
स्कैपुला रुब्रिक क्यों नहीं?
Yes.
हेलो,
Yes.
इसमें सर रुब्रिक स्कैपुला क्यों नहीं लिया गया?
पेशेंट ना एग्जैक्ट फिगर आउट अगर करे ना स्कैपुला को, तो फिर ठीक है. पेशेंट कहता मेरी बैक पे पेन हो रहा है, अगर तो एग्जैक्ट लोकेशन हमें बताता, देन वी हैव टू, हम तब उसमें जाते हैं. पाठक रेपर्टरी को यूज करते वक्त आपने क्वालिटेटिव रुब्रिक लेनी है, क्वांटिटेटिव नहीं लेनी.
दैट्स अ परफेक्ट थिंग.
तो बिल्कुल पेशेंट को आप ठोस तोड़ के भी देखेंगे तो वो निकलेगा वो सेम. अब वो पेशेंट कह रहा है बैक पे होता है, बैक पे तो इतनी चीजें. सम पेशेंट में से सर पेट में दर्द है, एब्डोमेन में. अब एब्डोमेन में इतने सारे ऑर्गन है, किस क्वाड्रेंट में, राइट क्वाड्रेंट में पेन है, लेफ्ट में है, अम्बलाइकस में है, एपिगैस्ट्रियम में, हाइपोगैस्ट्रियम में. तो हमें मजीद थोड़ा डिटेल में जाना होता है.
सर ये मीटिंग 2 मिनट में एंड होगी. वी विल रिस्टार्ट विद द सेम लिंक इन नेक्स्ट सेशन.
तो अभी कर लें.
सर तब तक वो आप लर्निंग बता रहे थे, कुछ वो बता दीजिए लास्ट केस से रिलेटेड.
तो हमारी लर्निंग भी यही है, हमारी लर्निंग भी यही है कि फाटक रेपर्टरी बेस ही जनरलाइजेशन पे करती है। हमने जनरलाइज करना होता है लोकल सिम्टम्स को। ट्रू फॉर द पार्ट इज ट्रू फॉर द पेशेंट, ट्रू फॉर द पार्ट इज ट्रू फॉर द अगर अगर एक मेरा मेरा फिंगर में पेन है, ये एक पार्ट है और मुझे लगता है दबाने से सुकून मिलेगा, तो ये मुझे इसको जनरलाइज करना है कि प्रेशर एमेलुरेशन को जनरलाइज करके एक रुब्रिक लेनी है, प्रेशर एमेलुरेशन। और और ये अगर बॉडी के किसी भी पार्ट पे हो, अगर वो पेशेंट कहता है मुझे सर में दर्द है, मेरी नेक में पेन है, दबाने से सुकून मिलता है, तो हम एक ही रुब्रिक लेंगे, प्रेशर एमेलुरेशन। सर आई थिंक एक दफा वो मीटिंग को स्टॉप करके दोबारा रीज्वाइन करेंगे।
Sir, a question, a case related nose obstruction lying on, cannot we take the PHATAK Repertory? Dr. Jinal Tatred is asking.
सर दोबारा प्लीज।
Nose obstruction lying on, can't we take this rubric in this case? The last case.
एक सेकंड। सर हमने इसको जनरलाइज किया ना, डायरेक्शन ऑफ सिम्टम्स को।
Okay, okay. So she had got her answer now. I am ending this meeting now and we'll restarting immediately.